Welcome back to Houston Life. If you've ever had dental problems, you might know what it's like to hide your smile or to have issues biting or chewing. But new technology in dental implants can provide life-changing results. Periodontist and founder of the Texas Dental Implant Center, Dr. Michelle Azar, joins us now with his patient, Matthew Dyson, who recently got a full smile makeover. You can see the big smile. Matthew, your teeth look fantastic. This wasn't always the case. You told us during the break that you were having issues with your teeth for what, about 20 years?
Yeah, about 15, 20 years. They gradually started getting worse due to just a lack of dental care after high school and college. You know, just kind of slacked off. A little bit of bad genetics, but I had not a whole lot of enamel on my teeth, and I lost some back teeth due to root canals or whatever, not finishing them up. But I ended up losing the teeth, which caused me to chew on the front of my teeth and
Putting more stress on the front of your teeth.
and cause them to chip down. Yes.
Obviously, your teeth have had a dramatic transformation. You look like a different person almost. And this is, your teeth are important, and to anyone, they're important, right? But for you in particular, you work in the hospitality industry, you're chatting with people. I mean, were you hiding your smile? How are you going about your days?
Oh yeah. I mean, I work at Perry's Steakhouse, which is a nice restaurant, and you've got to be very verbal to your guests. And it's hard to be verbal and have personality to your guests if you don't want to show your teeth, you know. And
Yeah.
if you laugh and want to, you know, cover your mouth, it's embarrassing. It's, you know, it's not very, it hurts your confidence. So this is taking my confidence to another level.
I'm guessing you're not covering your mouth when you're laughing anymore.
Not anymore.
And you can chew and eat.
Oh, I can eat everything now.
That's a big change. And this, Dr. Azar, is something that you see with your patients regularly.
Yeah, so like he explained, back teeth were missing, so majority of his chewing was on the front, and the front teeth are not really meant for chewing harder foods. So over years, it just takes a toll on it and start to wear down.
Little by little, then, the decline was happening. We have a 3D digital X-ray, which I think is fascinating that this technology even exists. So you were able to take a look at Matthew's mouth and really identify what was happening, not just visually, but also under the surface of the gums.
Yeah, so that's an example of the X-ray we take on the consultation visit for us to evaluate the teeth and also evaluate the bone where the implants are gonna go.
So you can see the bone was also having issues.
Yeah, so it's automatic. Once teeth are becoming missing, the bone shrinks because it's not being occupied by teeth. But this also helps us to study the feasibility of implants. Now, with our techniques, we're able to provide on the same day that we take the teeth out, the implants, and then go there with the immediate teeth right away.
And here's another look at a 3D situation where we're essentially seeing a before and after situation. Matthew, for you as the patient, when you were able to see how your teeth would transform, this must have been a cool moment.
It was exciting. It was very exciting.
And tell us a little bit about how you ended up going to see Dr. Azar, because I understand you and your wife Heather, shout out to Heather.
Hey, Heather.
You were watching
Watching your show.
a television program called Houston Life. I love that, makes me so happy. And what pushed you over the edge to say, hey, I'm finally going to do something?
I was just watching the show with one of your patients and thought, gosh, that could be me, you know, and almost let the screen go, and I pressed pause on the show and, you know, screenshot.
The information.
Yeah, make the call, you know, this guy will take care of you.
How, other than just being more comfortable chewing and interacting with people, I mean, you were a quarterback at Texas State, you're a big guy, you've got a big personality. How has your life changed since your new smile happened?
It's exponentially changed. I mean, my personality is huge. You know, if I laugh, I don't want to, you know, if I laugh, I want to, you know, with my whole mouth, you know, and my personality is big, and I like my smile to be big.
You don't have to hide anymore.
Right, no, not at all.
And what I think is really great about this, and we have met a number of your patients like Matthew, Dr. Azar, so many people are told, because you are an implantologist, periodontist, which requires much more training than just regular dentistry, a lot of people out there maybe have been told by a dentist, like, hey, there's nothing we can do, you have too much bone loss. Who is the right candidate for a full mouth makeover like Matthew's?
I think we see this trend a lot. A lot of our new patients or consults, they tell us that their own dentist told them that they don't have enough bone and there's no way for them to get implants. But the moment we see them and start taking the records, it's clear to us, because we do it on a daily basis, that this is a pretty straightforward case if you do it every day. So our perfect candidates are people who are struggling with dentures, first of all, because dentures are very uncomfortable. They actually eat your bone away. People who had a lot of full mouth reconstructions with crowns or veneers, and it's coming towards the end of its lifespan, or people who want to improve the way they look.
Well, you've certainly improved the way Matthew looks. You looked great before, but this is like a full, it's nice and bright too. They look natural. They look like your teeth.
Thank you. Yeah, I mean, yeah, it's nice to be able to smile and not hide, you know, so.
Well, these before and afters, just the x-ray alone, it's incredible how far technology has come. Matthew Dyson, Dr. Michelle Azar, it's great to see you both. And congrats, Matthew. Say again, hello to your wife, Heather. I hope you have a nice date night chewing whatever you want to chew. Food-wise at dinner, I mean, steak. Okay, the
Thanks
Texas Dental Implant Center does have a special offer for Houston Life viewers. The first 20 callers will receive a complimentary consultation after a pre-qualification call. That includes a one-on-one chat with Dr. Azar, 3D scan, also x-rays. That is all a $1,000 value. You can schedule your appointment by calling 346-1ARCH. That's 346-663-2724. You can also go online, bestdentalimplantshouston.com. And don't go away. Houston Life will be right back.